We're going to get it good. Hi, welcome to the Safe Disposal of Medications. I'm Gene Ransom, the CEO of MedChi, and this presentation is made possible from a grant by the state of Maryland Opioid Operational Command Center. Today, we're going to talk about the safe disposal of medications with Dr. Tom Walsh, who is an expert in lots of things. Dr. Walsh graduated from Rush College for med school. He was one of the founders of Maryland Primary Care, practiced there for quite some time. Then has done some work with several hospices in Maryland as the medical director. And he is also currently elected to his second term as an Orphans Court judge in Queen Anne's County. So we couldn't have a better person to talk about this than Dr. Walsh. Good afternoon, Dr. Walsh.
Good afternoon. Thanks, Gene.
Well, I really appreciate you being here. And essentially what we're going to do today is talk about the importance of disposing of medications and how to safely keep them and deal with prescriptions and how it affects the opioid epidemic. And I can't think of anyone better than you to do that. And I guess maybe the best thing to do is to start off by asking, why is it important to dispose of the medications safely?
Well, Gene, this is a really important thing. You know, when I was in practice, just in terms, there's several reasons why you want to dispose of medicine safely. But one of the things I remember most significantly is teenagers that got in trouble with drugs. All too often, drugs sit around the house in bottles way longer than they need to, way past the time when people were using them for whatever the original intended use was, and these kids will get into these drugs as sort of an experimental thing or exploring. So that was my biggest concern about having drugs around. And mostly I was concerned about narcotics, but other things. I mean, it's amazing what kids will do when they get a chance to explore. And in addition to that, your pets can get into them. People can accidentally take the wrong medicines if they're around. They can cause all kinds of contamination in our water and sewer systems. So there's lots of good reasons why we shouldn't keep medicines around longer than they need to be.
So as a physician, when you write a script for a patient, what are some of the advice you tell them, or should you tell them about A, finishing the script, B, if you don't finish the script, what to do? What are some of the things that you should mention or have your staff mention to the patient?
Right. So, most of the time we want people to finish prescriptions, but there are some prescriptions that are written sort of as needed. And those kinds of things may be pain medicines. So on the antibiotics and the blood pressure medicines and diabetes medicines, we instruct people to take them as directed and take them completely. For medicines that are written sort of as needed, and those are, like I said, mostly pain medicines, we tell people that when your problem is resolved, we need to find a safe way to get rid of this medicine, and don't leave it around for the next time, because the drug may not be effective, or somebody may get into it, either intentionally or unintentionally. So we try to instruct them that there are places to properly dispose of medicines, and they should keep that in mind.
Yeah. So one of the other things that we hear, and maybe this is a little less on the healthcare side and more on the environment side, is don't flush medications down the toilet. And we hear things like it's bad for the environment, it gets into the water, the drinking water, and things like that. So then obviously the next logical question that usually comes up is, well, if we're not flushing them down the toilet, how are we taking care of them, and how are we disposing of them? So what is often recommended is obviously disposing of them by dropping them off in an appropriate place. So do you have some suggestions on how to dispose of prescription drugs safely?
Yeah, so there are several locations around the state where people can bring medicines that they don't want anymore. Every state police barrack in Maryland offers 24-hour drop-off. Several of the county sheriff's offices will take medicines that people want to dispose of. And occasionally there are disposal sites that might be set up, temporary disposal sites like by the Drug Enforcement Administration or other places. But there are websites where you can look that up. And I probably would start with either the state police or the local sheriff. I know in our county, the sheriff's office will take them. And if you don't mind, I want to go back to that toilet issue, if you don't mind,
Okay.
because I
Yeah,
have a story to
100%.
tell
Yeah.
you. I had a friend who was very sick for a long time. He was actually a physician. He was very sick for a long time and had a lot of medicines.
Mhm.
And he lives in a rural area of Harford County. And so you think he would know better. This is a very well-trained surgeon. But when he finally recovered, he took all of his medicines and flushed them down the toilet. And he had a septic system. And he told me that, oh, I don't know, several days later, he was out in his backyard and it smelled like sewage really bad in his backyard. And he couldn't figure it out. It got worse and worse and worse. And basically, he called the septic company and they came and they said he had basically sterilized his septic system with all the unused antibiotics that he flushed into his septic system, which ended up costing him a whole lot of money to fix.
Oh, wow.
So,
So that's a good way to show that it really does affect the water and how we live when you
yeah,
do that.
you'd think this
So
one bottle of pills couldn't really affect the septic system, but they do.
no, that's a great example. I'm glad you shared that. I also want to talk, and you've kind of got three sets of experiences that all relate to disposal of medicine. And we've talked a little bit about as a primary care practitioner, as a physician, and telling patients what to do. And more recently, you've been a medical director for hospice. And a lot of times hospice patients will be taking large amounts of medications and sometimes some very big time medications. So what do you advise, or what do you suggest that the practitioners in the hospice advise patients with regards to safe storage and handling medications and what to do when the inevitable occurs?
Right. This is a tough problem because we do prescribe some pretty potent narcotics and other medicines in hospice, and it's the hospice provider's job to try to keep their eye out for what the situation looks like at home because that's an easy setup for other people to get into medicines that are not their own, and also when the medicine might be discontinued, even while the hospice patient is still alive. Sometimes they just sit around while as the case proceeds, and I think it's important to let the family know that when medicines are no longer being used, they need to let the hospice nurse or the hospice nurse practitioner or physician or whoever know that we need to find a safe way to get rid of this. We need to keep medicines in a safe place because we don't want medicines transferred to people who they weren't meant for. And so sometimes they have to be locked up, or sometimes we even, as hospice providers, we occasionally have provided lock boxes for families to make sure that medicines are kept safely.
That's a
So
really
it's a
that's
big issue in hospice. And then, of course, when the person dies, oftentimes there's a lot of medicine left over. One of the sort of things that we do all the time in hospice is the nurse will go out and try his or her best to make sure that medicines are properly disposed of. But that requires cooperation on the part of the family. And it's not a great time for families, to have that discussion, but it's an important thing to do, as the physician, that might be involved either as the hospice physician or the primary care physician that might be kind of, involved in the hospice case. They need to remind families that, take a look around, make sure that, there weren't any medicines that we don't need anymore that have been left around that somebody could get into.
and I think this is probably a lot of those issues also occur in your role as an orphans court judge, where you're dealing with an estate where the person obviously might have been sick or taking large amounts of medicine, and then the family's
Yeah.
got a responsibility to deal with that, and they probably have no idea what to do or
Yeah,
how to
that's a
do it.
very similar situation because these are situations where someone has passed away, everybody's distraught, nobody's really thinking about all the other side issues that could happen. But, a lot of times, the family or personal representative or the person's, POA, power of attorney, needs to make sure all that stuff gets properly disposed of.
Yeah, and again, we were talking about the dropping it off is always good. And here in Queen Anne's County, Sheriff Hoffman will take drugs at the sheriff's office, and I think you did a good job outlining other opportunities to dispose of drugs safely. Um, so what do folks do if there's no disposal sites in the area, and the answer really is they can use one of those disposal bags that they should be able to get at a pharmacy, or if they contact the Queen Anne's County Medical Society, we can provide them for them. But then they can also mix the medicine with something like dirt or coffee grinds and put the mixture in a sealed bag or a coffee can and throw it into the household trash.
Right.
And
I, I sort of feel like that's a last resort, but I think it's a good last resort. But there's so many opportunities to get dispose of medicines now at local police departments and sheriff's offices that I don't think it should have to come to that too often.
Right, but obviously, given your doctor friend in Harford County, we certainly don't want them flushing it down the toilet. I
Well,
mean,
exactly. And some
yeah,
people think they're doing the right thing and they're not. Yeah.
right. And I do think also it's important that that patients scratch, get rid of, and destroy the information on those labels as prescription labels.
Well, yeah, there's a lot of protected health information on those labels.
Yeah, so I think that's something also when you're disposing to think of that you need to deal with and you want to deal with because you don't want that getting out.
Yeah.
So I
Good
wanted to
point.
talk a little bit about the opioid epidemic, and I know you're very involved in the community and everything, and this has been something that's affected the Midshore and the Upper Shore particularly harshly. And you mentioned it when we were talking a little bit from the very beginning, but I don't know if you want to comment about why safe disposal is important to the opioid epidemic or not.
Right. This is a big problem because people, I think, start using opioids oftentimes when they're given I think with good intention, given it to them from a friend, like, oh, you have got back pain, here, use this. My doctor gave it to me 6 months ago and it worked really well. Um, that's not really good to share medicines like that. But also, people end up with the wrong medicines and then they end up with narcotic medicines that kind of get them dependent on narcotics. And like I said earlier, that happens a lot with kids that are experimenting with things for the first time in their life. But it's not always kids. I mean, sometimes it's adults and other family members and friends. And so, getting rid of medicines when they're partially used and no longer needed. I mean, you're doing a favor to your friends and your kids and relatives just to prevent misuse and have them transferred to the wrong people.
And we've heard lots of stories of the different ways that people have gotten engaged with regards to opioids or illegal drugs. And you hear everything from, well, my drinking buddies gave me something, to try out, or in the traditional ways that we take addictive materials. But the most recent version of the opioid epidemic, we've heard more and more stories about someone who got a few too many pain kills from a practitioner, or somebody who took a relative's or a grandmother's medication when they weren't looking, and you hear those stories as well. So I think
Yeah.
it's something that's really important to think about, is getting rid of the extra pain pills, or getting rid of making sure that things are locked up and safe and away from folks who might make bad decisions.
Right. And this isn't really about disposal, but I could tell you a lot of stories about people who have um in a bad way have stolen medicines from, older people, especially the grandmother who had a broken hip and received some pain medicine, and the next thing you know, she doesn't have any pain medicine left. But some person in the family either all at once or slowly started stealing grandma's medicine, and so it, it uh, it's really important to keep things in a safe place and accounted for, because that does happen. And people come into your house and can do that. All kinds of people can.
And I also think that again, as I kind of switch your hats occasionally as an orphans court judge, that's a big risk in estates, because you might have a situation where someone dies and then the cousin or somebody else rolls into town, and so it's really important in those situations where you're dealing with someone who's sick or at the end of life, that you have those discussions and you figure out what you're going to do with it.
Yeah, exactly. Oftentimes someone will die, and then all of a sudden everybody who thinks they're going to get part of the estate is gets involved in so-called cleaning out the house, and that's not a good time to have a lot of unused or dangerous medicines around that could put people in danger. So, but yeah, you're right. It's amazing those kinds of things do happen.
So we have some suggestions here if you want to learn more about the safe disposal of medicine. There is safety disposal of opioid medicines before they can do harm, which is a video from the FDA. And then the other is keep your family safe from unused opioid pain medications from the FDA, just to drive home that point. But I do want to reiterate that while we've talked a lot about opioids and the opioid epidemic, that some of the other medications that might not seem harmful can actually be very harmful if you take someone's else as medicine, or if you take someone takes medicine they shouldn't take, it can cause a lot of damage even if it's not an opioid.
Right, exactly. And we have all kinds of drug interactions that people aren't aware of. So sometimes people are taking a medicine for one thing, and then the next thing you know is they find a medicine around. They say, well, maybe that'll help me, And sometimes those medicines interact in a bad way, and they don't realize it, and they get themselves into some trouble. And you're right, it's not always opioids. These medicines do interact in ways that they may not be aware of.
So one of the things that came online when you were still, I guess it was near the end of your time as a primary care doc, was the PDMP and CRISP. And one of the things that I think physicians do is they will, when they're making a decision about prescribing, they will actually check that and see what medications you're taking, or they will check the medications you're taking in the electronic medical record and try to make sure that there aren't any of those interactions.
Yeah, you're right.
So, yeah, so if you're pulling something off of your brother's shelf or your grandma's shelf to save some money to try to take care of yourself, you could be doing yourself a lot of harm.
Right. The PDMP is helpful on an individual level, but if somebody's like snooping around and, well, maybe this will help me, and they take their brother's or mother's medicine, they can get themselves into trouble.
Right. So just to I turned on the video there by accident. I want to talk a little bit about sharps, and this is a complexity for a lot of people. More and more, we have a lot of patients who are using sharps to take medication, and then of course, physicians' offices end up with sharps. So, what do you do with used sharps, and how do you deal with that problem, Dr. Walsh?
Well, it's getting to be a problem because more and more people, well, as we all know, there's a lot of diabetes around, and there's a lot of medicines that are given by injections anymore, and for diabetes or for other things, and that's a good thing that people are not afraid to give themselves shots and all that. But you do end up with sharps, needles, or the things you stick your finger with to test your blood and whatnot, and those need to be disposed of properly. So, we need to put those. You never want to just throw them in the trash, or certainly not in the toilet, because people can get into the trash and get stuck with them, and they either get exposed to medicines or other blood products that would put them at risk for diseases. So you can use containers, these hard plastic containers that you can either buy, or sometimes, like in the picture here, there's looks like it's a laundry detergent bottle, or if it's a thick plastic, you fill the container with these sharps. You don't want to fill it completely up because you don't want to start pushing your hand down in there and get yourself stuck. But then you get it sealed up with duct tape, and you don't put that in a recycling bin. You bring that to a proper sharps disposal drop-off location. We don't have as many drop-off locations for sharp containers as we have for unused drugs around the state, but several counties have places for drop-off locations, and I think that's on your slide there. And so you want to dispose of them properly in one of those drop-off locations, and not just like I said, loosely in the trash.
And also, it's my experience that if you have EpiPens or other units that might be sticks or sharps, that you can oftentimes drop them off at the sheriff's office as well, as long as they're in the packaging. So it really is just for someone who's producing large numbers of needles. I think the
Right.
biggest takeaway here is don't just throw them loosely in the trash can. You don't want someone getting stuck or creating access to the blood or other pathogens that could cause a problem for somebody else.
Exactly. And we've all been to the beach in one place or another and seen needles around. I don't know how they got there, but you don't want them just out there in the environment where people will step on them or get stuck or hurt. So they need to be disposed of properly. You're right.
So, in the last thing I wanted to touch on briefly with regards to disposal of medication and medical waste is healthcare facilities, and I won't take a lot of time on this, other than to say that there are very specific rules about how physicians' offices, hospitals, any healthcare facility that's licensed by the state has to handle and deal with medical waste and extra or expired medication, and it's really important to make sure that you have a plan in place for that. And there are state rules and federal rules. And again, you have to have a plan in place to protect infectious disease transmission and to deal with these types of medicines.
Right.
If this is something that you need help with in your practice, you can always reach out to MedChi and we can help you do it. I don't know if you want to comment on that at all, Dr. Walsh.
Well, I'll just say that, I've been around for a while, and I remember the old days when there weren't any regulations, and there was a lot of crazy stuff going on with, needles and finger sticks and all that stuff just being stuck in the trash before we all knew any better. But luckily, I think the state and the federal government has sort of cracked down on that, and I think it's been a really good thing, that we now have much safer and better ways to get rid of medical waste.
So, as we kind of close up here, was there anything else, any thoughts, final thoughts, that you'd like to share with the folks, with regards to the safe disposal of medicine, the opioid epidemic, or things they should think about with regards to prescriptions?
I think number one is, I don't think it's a great idea, although you hear it all the time. People say, I got I got 20 Percocets and I only use four. It's great. I can have it around now. It's just not safe. I can't tell you how many times when I was in private practice that I saw teenagers get in trouble with opioids that were, in the medicine cabinet, and they somehow found their way to those drugs. So I think it's a big way that um, teenagers and young adults get started using narcotics that they shouldn't use. So I know I've said that 3 or 4 times during this talk, but I really mean it. So I think it's really a good idea. Just don't keep the stuff around. Do everybody a favor and just get rid of these unused drugs, and not just opioids, but especially opioids.
And I also think it's really important for physicians to take a few minutes and just make sure they or their staff tell them that it's important to safely dispose of the medications.
Right. That's a really good point. We get busy every day, and sometimes, we give the patient a prescription and we don't stop and tell them, listen, if you don't use it, there's ways you can get rid of this safely.
Yeah. So, well, I really appreciate you joining us today and talking to us a little bit about the importance of safe disposal. And thank you very much.
Yeah. Thank you.